Hi everyone, I'd like to introduce you to Sarah Doll. Sarah Doll used to belong to my sister, and then she got passed on to me, and I used to play with her as a child. And then when I was a teenager, my siblings used to hide Sarah Doll in my bed or in my cupboard, and I'd come home when it was dark and find her, and she was a little bit terrifying. But today we're mainly going to be focusing on Sarah Doll's genital tract. So let me start talking about that. Sarah Doll's vagina is not a sterile environment at all, like most women. In fact, it's full of bacteria that are potentially pathogenic in most cases, as well as non-pathogenic bacteria. For example, the majority of the vaginal flora in most women is lactobacilli. These are bacteria that produce hydrogen peroxide, keeping the vagina acidic and protecting women against bacterial infections. The upper genital tract, so beyond the endocervix, is sterile. There's no bacteria living there under normal circumstances. And the mucus in the endocervical canal prevents bacterial ascension into the uterus and beyond. Today we're going to be focusing on pelvic inflammatory disease, which is when bacteria ascend past the endocervical canal and involve the upper genital tract. So what is infected in a patient who has pelvic inflammatory disease? Firstly, the endometrium is infected, and then the infection spreads beyond the endometrium to the tubes. From the tubes, it spreads to the ovaries, and then at that point, if the infection progresses, a tubo-ovarian complex can form, which is a pus-filled collection in this area. And then after that, if the infection is not stopped, it will progress to local and then generalized peritonitis. So, in almost all cases, PID is caused by sexually transmitted bacteria. And I'm going to speak about some of the risk factors for PID now. Let me stick this one on. There we go. So those are the main risk factors for PID. Let me move this a little closer so you can see them. So one risk factor is early sexual debut. Another is young age, less than 25 years of age. And then a high number of sexual partners. So the more sexual partners a woman has, the greater her risk of contracting PID is. Low parity is also a risk factor, and perhaps this has to do with the hormonal changes during pregnancy and breastfeeding. Those hormonal changes cause thickened cervical mucus and make a woman less likely to get an ascending infection. Low SES is also associated with PID, as well as bacterial vaginosis. If you don't know what bacterial vaginosis is, it's when anaerobic bacteria begin to overgrow in the vagina instead of the normal lactobacillus. And that can also lead to PID. Previous PID is a risk factor for future PID. And then let me just speak about contraception a bit. Contraception plays a varied role in PID risk. Using condoms or other barrier methods actually reduce the risk of PID contraction. They're protective factors, but the IUD can increase the risk of PID. Now, this is mainly in the short term. So after the IUD is inserted, because the IUD is pushed up from the vagina and through the endocervical canal to stay in the uterine cavity, as it is pushed in that direction, it can cause bacteria to ascend into the uterus. So it breaks the natural protection that is offered by the endocervical canal. So for that reason, shortly after an IUD is inserted, there's an increased risk of a woman contracting PID. If a woman gets PID, shortly after or anytime after an IUD has been inserted, there's no need to remove the IUD. Normally, PID can be successfully treated with the IUD in situ. If the woman doesn't recover quickly, then you can remove the IUD, but that's not normally necessary.